Martin Knapp, Professor of Social Policy here at LSE, author of so many articles and books, advisor to governments, NGOs. Beveridge had this idea about a free health service. In fact, it was absolutely central to the whole premise of what he was offering. It's a pipe dream today, isn't it? It's one of those things, it's just, its time has come and its time has gone, if we're being honest.
No, I don't think so. I think it has actually kept its shape pretty well from the Beveridge vision. I think it's still pretty much free at the point of use. Yes, people pay for prescriptions and there might be concerns about that, but I think generally speaking it's held up pretty well. I think the difficulties have not been with the principle or the concept or the structure, but with the level of funding that's going into it.
Right, but I mean, you say prescriptions. Is it in a way that inequality has taken over from health as a key indicator?
I mean, the inequalities in health and access to healthcare at the time of Beveridge were enormous. They were very, very wide. I think the sad thing that many people observe today is those inequalities are still way too wide. And in fact, there was a period when they were narrowing, and I think in the last maybe 10 years or so, they've widened again. So I think we still have a big challenge there. And so, yes, I think people do find it difficult to access services. The famous sharp elbows of the middle classes do play quite a big role in health service access, I think.
Yeah, so they then are in the places with the right postcode and so on, and without over elaborating it, sit at their dinner tables and say, isn't the NHS marvellous? But actually aren't being honest about the challenge of resources for the National Health Service.
Well, I think that may be an element of that, but I think you're going to go look across the Atlantic to the States and see what happens to people in low-income groups there and their terrible access to healthcare, and then see how well we perform. So I think we're doing very well. We could do a lot better, and I think the worry that many people have is about those inequalities that start actually before birth and continue right through the life course, and in fact widen across the life course.
Yeah, but both in Britain and generally across the world, nobody would have foreseen when Beveridge was writing, and least of all Beveridge, the huge cost of delivering amazing gains in the fighting of disease. So we're trapped, aren't we, by the amazing breakthroughs, which mean it's so expensive.
Yes, I agree. I mean, you get new medications which are enormously costly, you get new bits of kit which are very expensive to use in hospitals. Where the successes have come, in the high-income parts of the world at least, have been in that public health area, in that prevention and working across the life course. We've seen huge increases in life expectancy, although they're very unequally distributed across the population. But with those increases in life expectancy have come new challenges. So we've dealt with the transmitted diseases, the communicable diseases are more or less under control, I would say. But we've got these whole new conditions. Dementia is one that I do a lot of work in, which are really challenging our country and many countries across the world.
So there are consequences of success. I mean,
yes, absolutely.
Would it be a better use of resources to be smart? Say, take somebody like Larry Summers, smart fiscal policies. So we say alcohol's a problem, smoking's a problem, sugar, and we address those at the point of source. And so we worry less about disease and more about prevention.
Well, it might be, but we know in relation to alcohol and smoking, for example, one of the best ways to cut consumption levels is to put up prices through taxes.
Yeah.
But the problem with that is it's very regressive, because then people on lower incomes who are paying a higher proportion of their income for the pleasure of a cigarette or a drink are then suffering more when the taxes go up. So we need to balance it very carefully. It's a very difficult trick to achieve.
I see what you mean. Now you're in a balloon because we're competing among the various giants. And this is a tricky one, if I may say so, I think, for disease or health, because you've got want in the balloon, you've got squalor in the balloon, you've got idleness, and you've got ignorance. These are the other four. And in some ways, from what you're saying, and generally, this one is a creature of the other ones. In what way is disease, health, more important than challenging poverty and the other giants?
I mean, firstly, I agree. It is a consequence of the other giants. It can be influenced by those. But in turn, it also influences those other giants. And so health problems in childhood, which are much more common in lower income families, will then have consequences for that young person's ability to complete their education, to get a job, to establish themselves as an adult in the workforce, and so on. I think what we have to remember with health is that health and concerns about health pervade the whole population. Everybody in the country has experience of health services, and not everybody in the country has experience of ignorance or squalor.
So still a pretty critical giant,
yes.
In your opinion.
I mean, you have to be very careful about that. I'm not arguing against that focus on disadvantage, but I do think that universality of experience fuels a lot of demands for a better health service.
Martin Knapp, thank you so much for submitting yourself to a Beveridge Gearty Grilling.
Okay, thank you.